Dr. Kevin Potter is a gastrointestinal surgeon specializing in bariatric surgery and medical weight loss at Dignity Health Weight Loss Center at St. Joseph's Westgate Medical Center in Glendale. He's helping patients reclaim their health and confidence through surgical and non-surgical weight loss. Welcome, Dr. Potter.
Thank you. Yeah,
you know what I'm going to ask. Everyone's asking it. When do you know when a patient should be on GLP-1s or when they're a candidate for bariatric?
Yeah, that's a great question. Thank you. Thanks for having me. It's a great opportunity to talk about, what we do and try to help patients. I think, there's a lot out there about GLP-1s and a lot of opportunities for patients to lose weight beyond surgery. And I think that it's great. I mean, I think one of the things we try to focus on is just helping people lose weight. But I think it's very clear when patients are better off with surgery. And it can be a multitude of problems. Chronic health conditions like poorly controlled diabetes, severe gastroesophageal reflux disease, sleep apnea that's being very difficult to treat with CPAP machines, blowing of the wind in the face. And more common scenarios, patients who need some other operation, a hernia repair or a total joint replacement. And those patients need access to more rapid weight loss and more definitive weight loss to get to the point where they can have those operations. And these are the patients that we see are probably better off with a bariatric operation as opposed to taking a GLP-1 because the overall results are so much better and, again, more rapid. And so we're trying to get more rapid resolution of weight and comorbidities to improve health.
So someone comes to you and they need knee surgery, but their orthopedic surgeon is saying, I'm not going to operate on you because you're 350 pounds.
Right.
You need to drop this weight and then we can get your leg fixed.
Yeah. And the real issue becomes, because most patients really focus when they're trying to lose weight on physical activity. Well, I've been trying to increase my physical activity, but my knee's stopping me.
Right.
And so I feel like our job is to reassure patients that only about 20% of what weight loss is about comes from physical activity. That means 80% comes from what you do with food.
What is the effect of bariatric surgery? What is the sensation and the feeling for your patients after they've had it?
Yeah, to me, it's very clear. It really can only do two things. The primary mechanism is it suppresses appetite. It makes you not hungry. So after surgery, you have to really be willing to not eat, which is something we really focus on before surgery. And then when you do eat, it has the effect of limiting how much you can eat.
All of us are at war with these snack foods that have perfected scientifically ways to become addicting. Your box of crackers, your chips, your cookies, they have they're maximal salt, sugar, fat. They're at a sweet spot, and it's very hard to contend with that.
Yeah. I mean, I think this is the largest driver of what is obesity in America today. And snacking is one of the #1 behaviors that we're constantly trying to get patients to take a look at and understand that this is what's promoting obesity. All those foods tend to promote appetite, and they tend to promote appetite for that type of food. So if it's something salty, you tend to want something salty all day long. If it's something sweet, which is the most dangerous, then you tend to want something sweet all day long, and it's that sort of continuous consumption of calories through the day that makes it really impossible to lose weight.
I know that many of your patients are contending with serious metabolic disorders and that losing weight is really helping them. But I'm curious, because you do keep in touch with your patients long term, what emotional changes do you see in your patients?
Yeah, well, it can run, a wide variety of potential changes, but generally overall, they're mostly very positive emotional changes because a sense of control returns, right? And everybody loves to be in control of their life, And so getting that reassurance from self that you have control of your life, that you have the ability to control what you're doing, and you're able to get what you want out of life is usually the most positive change that we see.
This is something that I was asking myself. Do I love myself? Do I want to live a healthy life? Do I want to live longer? And the answer was yes. And if you can say yes, then you know you need to make a phone call. The staff was amazing with Dignity Health. From me having my consultation to having my appointments, my follow-ups, my weigh-ins, to checking in at the hospital, you're going to get the support and the guidance that you need from a team of professionals. So you're not going to be alone. I'm loving the results. I'm loving the new me. I'm not done yet. This is who I was meant to be. And I'm sticking with it.
Dr. Potter, thank you so much. If you want more information, if you think you might be a candidate for surgical or medical weight loss, you can go see Dr. Potter. You can learn more on our website, cw7az.com. Thank you so much.
Yeah, thank you.
The preceding portion of the Arizona Daily Mix was sponsored by Dignity Health.